one of the women stood up in the back of the room, and I said, I said this because what the answers I gave were really not complicated and relatively simple, that a rehabilitation therapist can address and either eliminate, prevent it from happening in the first place, minimize the effects, or if they have them, get rid of them. And one of the women, who I believe was a breast cancer survivor, stood up in the back of the room and said, "Why doesn't anybody know about this? And why aren't you doing anything about it?" So I felt a little scolded. So from that point, I'm like, well, I'm doing this, but I knew I needed to get out more and increase the reach of people we were getting to, both from the physician side, because our physicians are fantastic, but they don't know, they haven't been taught about rehabilitation in school. And we typically don't get taught about oncology much in school. So there's a big gap. I call it the cancer rehab gap. There's a kind of an overriding or underwriting assumption that people, once you're diagnosed with cancer, you're supposed to be miserable. That is not the case. And I think it's an assumption too, if I've had cancer surgery and I'm uncomfortable, if I have pain, that's just the way it is. And that is not accurate. The majority of cancers, especially breast cancers, with rare exception, should a person who's been through breast cancer surgery, whether it's partial mastectomy, with or without reconstruction, with rare exception, somebody should not be able to get back to 100% of their mobility, of their strength, of their comfort that they were preoperatively. But that doesn't always happen unless you have a rehabilitation assistance or go through rehabilitation with some manual therapy, some therapeutic exercise, a pair of specialist eyes looking at the soft tissue and the skin and at the chest, the axilla, especially if you throw radiation into the package. But people should expect to get back to 100%. And if you're not, even if it's weeks, months, or years later after your treatment, it's still time to get into an occupational therapist or a physical therapist to get that treated so you can be pain-free and functioning at 100%, because you certainly deserve that, especially after a cancer diagnosis. I always say that cancer care, wherever you are in the world, is very siloed. Okay, so you are working with a team of spectacular experts, but they are experts in their own part of you. So the surgeon does not know what the radiologist knows. The radiologist doesn't know what the radiation oncologist knows. The radiation oncologist doesn't know what the medical oncologist knows. And they certainly don't know what we do or what our particular expertise, or have our eyes on that particular patient. So I think the unique part of the rehabilitation piece after a cancer diagnosis is we tend to have a role for the patient from the beginning at diagnosis, all the way through surgery, all the way through chemotherapy, all the way through radiation, and even into survivorship. There's always a role for rehabilitation to be able to make an impact.